What do these 4 diseases of aging have in common? Heart disease, cancer, autoimmune disorders, and Alzheimer's disease. It's inflammation. That is the soundbite, the buzzword of the 21st century. And indeed, I call that the bane of our existence, because that's one of the many ways in which we age. How do we measure it? Well, it's a simple blood test called a C-Reactive protein. Ask your doctor to order it. I monitor my patients' CRP or C-Reactive protein on a regular basis. Now, there is one distinction I have to make. If you are in the throngs of an acute infection, let's say a cold or a flu, you don't want to measure the CRP because it will be elevated. But there are plenty of people walking around out there that have elevated C-Reactive proteins 24/7, and it is not good. When I was a fellow, cardiology fellow 25 years ago, I never heard the term inflammation. But now we know that same plaque in the coronary arteries is what we find in the mouth. How can we prevent it? Well, it always boils down to the big two: diet and exercise. I don't have to tell you that obesity is a major epidemic in this country. Adipose tissue, especially in the midline, is highly inflammatory. Almost every patient I measure who is overweight or obese has an elevated C-reactive protein. Not good. Sugar is the most inflammatory substance in our diet. The average American eats about 130 pounds of sugar every year. I liken it to pouring gasoline onto a fire. Cardiologists and internists for years have made a big deal about cholesterol and fat. I think sugar is our major villain. There are some supplements that you can take that may help combat inflammation. One that I particularly like is omega-3 fatty acids or fish oil, natural anti-inflammatory. There's a combination that I put together that I carry in my practice, and it combines turmeric, ginger, boswellia, and quercetin. And you have to look outside the box when it comes to looking at why you have inflammation. I've mentioned a couple of things, but periodontal disease, you need to make sure you don't have it. It needs to be treated. Sleep deprivation, sleep apnea, chronic sinusitis. These are all causes of chronic inflammation. So, be your own medical advocate. Do your research. If you have an elevated C-reactive protein, learn why and do something about it. After all, whose body is it? It's your body. And you can combat inflammation.